Welcome to What Self-Care Looks Like. I'm your host, Brittany Elliott. It may be hard to hear, but self-care is not spa days, a weekend getaway, or brunch with your bestie. True self-care is the practice of protecting your well-being and happiness, and it lives within your daily routine. I'm a self-care and mom life coach here to help you prioritize your needs and practice self-care in a meaningful way so you can reclaim joy in your motherhood experience. Let's get back to you. Hey, and welcome back to What Self-Care Looks Like. I am Brittany Elliott. I'm your coach here to help you rediscover your identity and reclaim joy in your motherhood experience. And our guest today is Dr. Hayley Hellstern. And before I bring her on, I want to read her bio, let you know a little bit more about her before we dive into our conversation today. It's really going to be about how to raise healthy, happy children, what to stock in our medicine cabinets, how do you treat our children at home when they have like colds and little sicknesses, and when it's time to take them in for medical care. So Dr. Hayley Hellstern is a board-certified pediatrician and fellow of the American Academy of Pediatrics, AAP. She was born and raised in Annapolis, Maryland, and earned her bachelor's degree in neuroscience from Johns Hopkins University. Between college and medical school, she spent several years in Pittsburgh, thanks to her husband, who had established roots in the city while attending college at Carnegie Mellon University. While in Pittsburgh, she volunteered in the Child Life Department at Children's Hospital of Pittsburgh, where she spent her days playing with children whose families were unable to be by their side while they were in the hospital. Dr. Hellstern then moved to Colorado to attend medical school at Rocky Vista University College of Osteopathic Medicine. She and her husband were thrilled to return to Pittsburgh for her pediatric residency at UPMC Children's Hospital of Pittsburgh, where Dr. Hellstern was selected as one of two residents in her class to partake in the Pediatric Advocacy Leadership and Service track. After several years in traditional pediatric office, Dr. Hellstern realized she was not able to spend enough time with each of her patients and their families. She desired a practice model that allowed her to check in with her patients after hours and provide them timely guidance when ill. Since her childhood, she dreamt of becoming a doctor who was part of the family, the way she always viewed her own pediatrician. She has joined Zest Pediatrics in a direct pediatric care model where she can provide the unique, specialized care each patient deserves. While Dr. Hellstern absolutely loves caring for children of all ages, she holds a special place in her heart for newborns and breastfeeding medicine. It brings her immense joy to journey with parents as they navigate the new world of parenting. She knows it takes a village to raise a child, and she would love to be a part of yours. I think that's beautiful. Outside of the office, she currently serves as an early career representative for the Pennsylvania chapter of the AAP and is a member of the Advocacy and School Health Committees. She is also a member of the Pennsylvania Breastfeeding Coalition. Dr. Hellstern is the mother of two energetic, adventurous children who love to keep her on her toes. She is always learning from them. She and her family enjoy long walks around their neighborhood, watching hockey games, and exploring the many playgrounds Pittsburgh has to offer. I hope you enjoy this episode and have a chance to connect with Dr. Hellstern. Let's talk more about it. Hey, it's Brittany here, your host of the show, and I'd like to invite you to grab your copy of my book, What Self-Care Looks Like. It's the roadmap for working moms who want to prioritize their self-care and rediscover the joy in their motherhood experience. It's a must-read for any mom who has felt lost, unseen, or unsure along her motherhood journey. Buy it today at www.whatselfcarelooks.com. Hey everybody, welcome back to What Self-Care Looks Like. I am here with Dr. Hayley Hellstern. I told y'all all about her in her bio, so I'm really excited to get into this conversation. But before we get started, do you prefer Dr. Hellstern? How should I address you?
Hayley's fine for this.
Perfect. All right. So, Hayley, we learned a lot about you in your bio, but I want to know a little bit more about your motherhood journey. So, can you walk us all through that?
Yeah. So I like to think that my motherhood journey started when I was a little girl and was playing babies. I mean, I have always wanted to be a mother. I'm the kind of person, some people never quite feel it. Some people feel it a bit. I was one where like part of my identity was I wanted to raise kids. And I think around that same time was also when I decided that I wanted to be a pediatrician. So I think those two kind of go hand in hand, very like loving, nurturing kind of, I don't know, heart or being that I have. But my true motherhood journey started in medical school. So I know these days many women are having kiddos in their 30s, 40s, even later. Um, but I really wanted to at least try to start having kids before I turned 30. That was kind of like my benchmark goal, so that if something were to be a struggle, then we would have several years to work through that before I turned 35, before I was considered advanced maternal age, what they used to call geriatric pregnancy. And so I just wanted to at least like give it a try in advance because I'm a planner, right? Like I think about it all, and I didn't want to have any regrets with this because the biological clock is unforgiving. So, partway through medical school, my husband and I decided, well, fine, let's do it. So, we started that journey, and within, I don't know, 6-ish months or so, I was pregnant with Ian, who's our firstborn, our boy. Um, and then I had him. That was the summer between third and fourth year of medical school. And then when he was about 1.5 or 2, we were like, you know what? Like now seems like a good time for him if we wanted to try to have another. So I had Eloise halfway through my second year of residency. And so we got a healthy boy, a healthy girl, and we decided to close up shop. We had
Good
one
planning.
of each, and we realized we were the kind of parents or close to it that we wanted to be for each of our kids, and we thought adding another one or more into the mix, not so sure that we could continue to do that. So we, at least for now, stopped there. We'll see what life has in store, but for now we're
Yeah.
not planning on any surprises.
I think that's beautiful that you took the steps to plan because my husband and I were on the opposite of that. We got surprised,
Yeah.
and that's its own like type of journey in itself. But I
Oh,
love that y'all took the approach to just like kind of plan and as best you can. You can only control what you can in that situation.
right.
But I know that medical school can be pretty intense and all the steps that it took. So even in your planning, like what kind of challenges did you encounter in your motherhood journey while you're also like juggling medical school and being a wife and just all the things?
Well, everybody thought I was crazy. So that was probably the first challenge is, even when I was like I was asking my like advisors, like if I were to become pregnant, what would this look like? And they were like, what are you talking about? Like, why would you do that? And some people were more supportive than others. And some were very, very much not supportive. So that was interesting. And the medical field, it's come a long way, and there are some really awesome folks, right, who are super supportive all the time. But there's definitely still like the old school folks, during some of my surgical specialties and some others during those rotations where it was very like, you show up at 4 a.m. and you don't leave till, 9 or 10 p.m. and that's how it is, and so that was challenging. I think part of the decision between third and fourth year of medical school. So the first 2 years, so medical school takes 4 years typically. The first two are kind of your book learning. So the way my medical school did it is you learn all of the normals the first year, all of the abnormal. So you learn the physiology the fourth year, the pathophysiology or the disease the second year, and then third and fourth year are where you go out into the wild and do your rotation. So you follow different doctors and different specialties to get a feel for it. So even though I knew in my heart that I wanted to do pediatrics, I still had to do at least a few months in surgery so I would know what taking out an appendix looks like. I would know, how to do the sutures and things like that. I did, OBGYN, all sorts of different rotations. So um because it was rotations, that just kind of like freed up a little bit of time. And with fourth year specifically in medical school, there's just like a little bit of extra time and a little extra wiggle room. And I knew that. And a lot of students kind of take off or chill the last several months of the very last year of medical school. And I figured, well, if I have a child before then maybe I could just like take that as my maternity leave, not that it's called that, and then just work up till the very end. So that's kind of how we decided to do it at that point. Plus, my husband and I had an apartment, he had a job, like we were stable-ish enough to feel like bringing a kid into the world wouldn't be a terrible idea.
Yeah, that's great. And I'm happy that you were able to, even though there were some naysayers, you at least were able to have the conversation with people. And I mean, you kind of have to pick what you are going to listen to and not listen to,
Totally.
just in all things, like even when it comes to parenting advice once your child is
Oh, yeah.
here. I mean, some things are like, okay, that sounds good. And other things you're like, yeah, I'm never actually going to do that. How
Hmm.
was it for you? Like once, like for example, like once Ian was born, he's here, you have your child, and did you like get thrown back into the fire of just your studies, or like how did you really adjust to like the mothering part now
That
that you were a
was
mom?
a wild ride. So first, labor and delivery in Boulder, Colorado is bougie AF. Okay. Like view of the Rockies, had like a steak dinner that night, courtesy of the hospital. Very different from, from Pittsburgh. So I was a little taken aback when I had a view of a gas station when I had Eloise. Labor and delivery was great. Um, Postpartum was tough. I was really fortunate that my breastfeeding journey was easy. Like it came very naturally to both of us. It was like a very symbiotic thing. I mean, we had occasional difficulties here and there, but overall, like that was not part of the stress for us, or like that dyad, myself and Ian. But when he was a couple weeks old, he got really sick and had a fever. And being a third, fourth year medical students, we joke, I knew enough to be dangerous. So I knew he had a fever. I called my husband. I said, Ian's going to die. You need to come home. Because I knew that fever in babies could mean really bad things like meningitis. And so we had to take him to the ER. I'm glad that I knew that. So we took him to the ER. We weren't near a pediatric ER that was like an hour and a half or two or so away. So we took him to the closer one, and we did this whole workup. So for those of you who don't know, new babies under a month old, really under 2 months old, who have a fever need an extensive workup to look for meningitis and sepsis and urinary tract infections and things like that. So he had blood work, he had a urinary catheter, he had spinal tap, actually twice because the first one didn't work. And so that was really traumatizing. And on top of that, even before that happened, I started feeling some really bad postpartum anxiety symptoms. So like I wasn't eating, he was unwell. Um, Fortunately, he ended up being okay-ish. We spent a week in the NICU on IV antibiotics. I was able to get the care that I needed from a postpartum standpoint. Fortunately, again in Boulder, Colorado, they had a couple NICU rooms, and I was able to sleep in with him. Right, I didn't have to go home and leave my baby because I don't think I left the hospital for more than 15 minutes total within that entire week. Whether or not that is healthy is debatable, but I couldn't leave like the one person I was taking care of, while we were there. Um, so that was a rough start a little
And how were things different with Eloise?
bit. So Eloise, sweet girl, labor and delivery was just different. I I was like close. I was term. I just wasn't like 40 weeks. I was like just a day or two shy of 39 weeks. She just like wasn't moving as much. And I had seen enough badness in my rotations and working in the NICU and things. And she wasn't responding quite as robustly to our, like testing and stuff. So I asked to be induced, and the doctors agreed that that would be fine. So with her, I had an induction. So that was different than going into labor naturally or on my own. Um, I probably waited too long to ask for an epidural, and then it didn't work. So that was a wild ride, right? Like an undesired, unmedicated delivery. Um, and but we did great. She was a little bit more challenging with breastfeeding. We were able to make it work, and I had done a lot of like lactation rotations and stuff throughout med school and residency, and I think I knew enough and had the resources to do well with that. I knew from my first time around that I was susceptible to postpartum anxiety and stuff. And so I was already, doing what I needed to be doing medically for that. Um, I had 6 weeks off for her. I think in residency, you get 6 weeks off, 8 weeks if you have a cesarean. So I was fortunate enough to not need a cesarean section. So I had 6 weeks off. And then I think I was able to do some sort of like read a parenting book and write an essay and learn some things that you didn't know about parenting. So I did that to extend it by another 2 weeks. So I think I went back to my rotations within residency at around 8 weeks postpartum, but I got thrown in. Not by any fault. Like there's it's just really hard to coordinate these things. So I went back to pediatric cardiology transplant. um, so that was a lot. And that was really tough because Eloise hadn't really taken bottles well at that point. She was um, refusing bottles. So my husband again was driving to the hospital because he was on his parental leave at that point so that I could nurse her in the car so she would at least get a feed throughout the day. And then she did what we call reverse cycling, where, because she wasn't feeding a lot during the day, she was feeding a lot at night. So I was up all night nursing her and then going to this like cardiology rotation. So little challenges here and there. But overall made it work. And my kids, just learned that when I was home, I just tried to be super present when I was home, right? I read something somewhere about it's not about the amount of time, it's the quality of time. So when I was home, I wanted to be fully present. And then when I was at work, my kids knew that I was at work.
Yeah, that's really great, and I appreciate you telling that story, like with both of your kids and your experiences, because I think that when we see doctors, right, who are moms, we're
Mhm.
just like, oh, they probably had an easier go, or like, there's just, we presume, like they knew so much more. They knew the conversations they needed to have, if they were hospitalized and while they were delivering. So they probably had it easier than maybe we did, but that's just not the case. I mean,
Right.
it's when we're having children, each experience is so different, and we
Mhm.
are growing through what we go through. And I think that your medical background has definitely helped you in
Sure.
that, but you still weren't able to control, like, I have to get surgery, my breast supply. I'm still thinking about the same things, and I imagine that that has made you a better pediatrician when it comes to the care that you give. So how do you navigate those conversations with new moms as they're coming in, because you kind of know, like, what their concerns are with when they're bringing their babies?
Yeah, I think there are great pediatricians who have never had children, right? There are great male pediatricians who've never given birth. There are great ones who have adopted and never gone through childbirth, and there are great ones who just don't have kids or who do have kids. I think I like to think that I'm a better pediatrician for my experiences because I get it. Though I also recognize that everybody has a different experience, just like I had two very different experiences between my son and my daughter. Um, I think, thinking back to residency, right, when I was doing spinal taps on newborns and counseling the parents of this is why, I was able to say, I know how heart wrenching this is and how much you don't want us to have to do this because I was there, right? I was the parent on this side. This happened to my son too. And this is why it's important, right? Because we were able to know that he didn't have meningitis and didn't need that extra level of care. Um, or, yeah, postpartum, right, is really challenging. I went through it too. I understand, how triggering it can be. Like for me, it was really triggering when people said, "Oh, sleep when the baby sleeps," because then I would be lying in bed like, "I can't sleep. The baby's sleeping, but I can't sleep because I'm nervous." Or my husband even would take the baby like in a good way, right? Just like, holding the baby, feeding the baby, and my mind was just I just couldn't, like, I was separated from that baby, and it set me off. So I now counsel my parents. I say, yeah, they say sleep when your baby sleeps, but just try to rest. Just try to calm your heart rate when the baby sleeps. Just try to be mindful when the baby sleeps. Just focus on a little bit of self-care in any way that feels right for you when the baby sleeps. Um, Things like that, right? Understanding that the breastfeeding journey is different from everybody. So yeah, I do think that being able to say yes, I've been there, and yes, this is really stinking hard, has been really helpful.
Yeah. Yeah. Thank you for that. I do appreciate that approach. And I mean, my daughter has a great pediatrician and we've had really great care
Good.
her whole life, but she was tough when she was born. She was very, very tiny, and we were the family that had to be in the office for her checks every single month for like 2
Mhm.
years
Oh,
because she was just a little baby, and they just wanted to make sure, like, if she was just gaining like an ounce, we were like,
yeah,
"Oh, this is a win." Whereas all the books that you read, it's like, "That's not enough weight. Like, is your baby okay?" And I
yeah.
was happy for that care, but then I had to navigate, well, how am I going to work? And every month I have to be at this appointment.
Yeah.
And that was, looking back now, I'm like, that was a pretty stressful time. It didn't feel like that in the moment, but looking back, I'm like, that was that was a lot, in
Yeah.
those moments. So it's nice to have time to just breathe through all the things we've gone through with
Mhm.
our mom journeys. And I want to hear a little bit about your perspective of just how can we raise like, healthy and happy children.
Oh, that's a great question. And I don't think there's a one size fits all answer. Um I think being there for our kids and loving them unconditionally and making sure they know that our love for them is unconditional is like at the crux of it all, right? Knowing that they can come to us with literally anything, right? Like you can tell me anything, you're not going to get in trouble. I mean, like maybe there's like a little bit of trouble, but um but having that open communication I think is number one. I think the quality of time we spend with our kids is also really really important and huge, not being glued to our phones, which is a struggle that even I deal with, right? I'm sure all of us deals with it in one way or another. So trying to be mindful of when I am doing this time with my kids, this quality time, like maybe I shouldn't be taking as many pictures even, because then that brings out my phone and then I see that I have an email and then I'm tempted to answer my email and then blah 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 blah. Like Haley, just put on your bathing suit and get in the darn creek. Like just get wet and put your phone away. Um, I think, speaking of creeks, outside time, I think kids need to be spending a lot of time outside. I think it was Mr. Rogers, actually, from Pittsburgh, who said that play is the work of childhood, or play is the work of the child. And, we have so much of a focus on school and learning ABCs and numbers and writing and stuff before they go to pre K or kindergarten. I think we need kids spending more time in the mud with sticks and leaves and learning balance and coordination, stepping on stones, and learning about bugs and native flowers and how to care for our communities and planting trees and picking up trash and just playing outside. So, when my kids are bored, I say, well, we've got a yard. Go outside and find something to do. You can garden, you can dig, you can find worms, you can play in your truck with your trucks. And studies show that dirt makes us happier. Playing in dirt, touching dirt and soil decreases the risks of anxiety and depression, which is really cool. And then I think there's this whole like clean, dirty kind of theory, right? Where the more we are exposed to, I kind of joke, clean dirt rather than like poop, dirty dirt, to this clean dirt, right? Like the environment, the more kids are like putting pine cones and sticks in their mouths and being exposed to different animals and stuff. It actually helps their immune system develop and helps reduce the risk of allergies later on in life. And so, again, I think, letting children get a little messy can do a lot of good in a lot of ways.
A good perspective. I like that.
Oh, I'm
I don't
glad.
feel as bad about letting my daughter go out and just do all the things, and she's collecting leaves, and
Oh,
I'm just
yeah.
like, go for it and just be a kid and love life, and but don't put too much of it on me because I don't like that.
Fair, fair. And there's the whole like structured versus unstructured, right? Like if we wanted to do structured with that, we could like print out a little thing with red, orange, yellow, green, blue, purple and say, hey, find something outside to match each of the colors. Right? Like that's if your kid's like, I don't know what to do, here, go. That requires a little bit of work. But honestly, free play, I think is huge. Huge.
Yeah, yeah, very healthy for us. I'm going to take advantage of the fact that I have a doctor on the
Right.
show, because during the school year, I felt like my daughter was always sick. And there was one time we went to urgent care, and like there were 20 other families in there with kids. We all were talking about the same symptoms when we checked in. And I
Uh,
was just like, why did I come if it's everybody's just sick right now? I didn't get the memo. So can you talk through like just childhood like illnesses, sicknesses, what we should stock in our medicine cabinet, like just give
yeah.
us the quick and dirty of how we can just make sure we're managing things at home and when is the red flag to like take them in.
Sure. So let me just start by saying kids are always sick. Like that's just a fact of life. Keeps me in business. Wish it didn't. But kids are always sick, right? I think kids get something like 6 to 8 colds per year. And of course, those are going to be consolidated within the winter months. And if you think about a cold lasting, 7 to 10-ish days, it's like a week, almost 2 weeks per time. That's like 12 or more weeks, like 3 or more months of sickness per year, shoved mostly in the winter months. That's typical, right? Like that's like a typical kid. Um, Especially when they're like first entering daycare, first entering a new school, things like that. So I first want to reassure parents that if you feel like your kid is always sick, it's because they are, but it's probably okay. If you're concerned, you can always talk to your pediatrician, but it's probably okay. Um, Oftentimes, viruses come and go around the school, and you'll have the whole community sick with something. As pediatricians, we're like, oh, it's, such and such season. Oh, it's hand, foot, mouth season. Expect all the hand, foot, mouth to be coming around, things like that. In general, a lot of things can be taken care of at home. So, some of the red flags that you talked about. So, breathing is one of them. If your child's having trouble breathing, if they're breathing really, really rapidly, or it looks like they're using, if you're seeing belly breathing or their retractions, which is where you can like see their ribs tugging when they're breathing, or this part of their neck is in and out as they're breathing, or their nostrils are flaring. Those are all signs that your child's using extra muscles other than their diaphragm to breathe, might be breathing a little bit um, with more of a struggle. That's a great reason to have your kids seen urgently, right? Um, Another one is dehydration. So if your child is, one example is hand, foot, mouth. Their mouths hurt, so they don't drink as much. Another example is, gastrointestinal stuff, vomiting and diarrhea, right? Like what they're putting in is coming right out. A general rule of thumb that a lot of pediatricians use is your kiddo should pee at least 3 times a day or once every 8 hours. Most healthy kids will do more than that, but that's kind of like a bare minimum. And if you're getting close to that bare minimum, that's a good time to touch base with their doctor for a fear of dehydration. So, respiratory stuff, hydration stuff. Altered mental status is the word that we use for like not acting right,
Mm.
decreased level of consciousness, if you will. So like if they're sleepy, that's fine. We all get sleepy when we're sick, but if you have trouble waking them up and they're not acting right like their normal selves, that's a good reason to be seen, like ASAP. And then really high fever. I think there's really no magic number of fever that's like, yep, you need to go to the ER if it's X amount. Um, just as a basic recap, and for those who don't know, a fever by definition is 100.4, 100.4 degrees or higher. So if your kiddo has 99.9 temp, that's technically, medically not a fever. Might be elevated for your kid, but not a fever. Um, with a lot of viral illnesses or bacterial illnesses, fevers can get up to 102, 103, even 104 or so. That can be normal in an otherwise healthy kid. So I usually don't focus on the number as much as how the kid is looking. If they are 103 degrees, but acting all right, eating okay, breathing fine, peeing fine, okay, right? Like maybe, if they're otherwise well, let it ride for a little bit and make sure that they're getting better after a few days. But if they're even 101 or something, but not acting right or getting dehydrated or breathing really fast or something, or really uncomfortable because of the fever so that they're not wanting to eat or drink, then that's a good reason to treat the fever. Does that make sense? Hopefully,
That
explain that okay.
is so helpful
Good.
because I think that just for me personally, I'm like focusing on the number and trying to see like
Yeah.
when is it time. And I know the doctor always says if you feel like they need to come in, just bring them. But
Totally.
that's you're right.
Totally.
Just absolutely bring them. But I try to, I'm like, well, my child is sick and I know that. I don't want to bring her out. She's not feeling well just to
Mhm.
be told she's fine, take her back home and do
Yeah.
fluids and everything.
Right.
And this is helpful for me because my child has brown skin. And
Mhm.
sometimes a doctor will say, well, is there redness or is there this or is she showing signs of this? And I'm like, well, her skin doesn't look like that. For example, she got like Lyme disease a couple years back and they were
Yes.
like, did you ever see the like spiral or thing?
The
And I'm
bullseye
like,
rash.
yeah, never saw any of
Mhm.
that. She was fine, but then, like, she was limping and she was
Yeah,
acting like chaotic, like different.
yeah.
And they were like, "Oh, those are signs too." And I'm like, "Well, we didn't know. We were looking for this and that." So you saying like this is how this would look, and like look at their nose and see how they're acting. Like, you know, your kid, bring them in. And that way it arms us with ammo to come in and say, "Hey, I know that her fever is only 102 only. I'm saying that. However, she's also acting like this and like that." I think that's helpful for you to know as the practitioner, and for me to
Exactly.
be able to say, "I did all the things at home. I'm here now because I don't know what else to do."
Because they're
And
not
that could
working.
help
Yeah.
it. Yeah, like help the appointment go a lot better. So that is top
A good
notch.
thing to keep in mind is treat the kid, not the fever. Treat the kid, not
Mm,
the fever. And again, this applies to otherwise healthy kids, right? It changes a little bit if you have a kiddo who's specifically known to be immunocompromised or on chemotherapy or something like that, or has sickle cell disease, for example. Like that's different. And
right.
hopefully, you know, those families are in touch with the doctor who tells them the details of how to care. Another thing that I want to go back to really quick, actually, two things. One is trust your mama gut. So I talked about when my son was really sick, before he spiked the temperature for probably 12 to 18 hours beforehand, I had like a feeling in the pit of my stomach that something wasn't right with my baby. But I couldn't put my finger on it. I was just like, he's just not right. He's a little sleepier than usual, maybe, but I was questioning myself and couldn't tell. He's not quite feeding as well, you know, like all of those sorts of things. Um, and then he spiked a fever, and I was like, "Oh, there it is."
Hmm.
But trust your mom gut. If you really feel like something is wrong, no good pediatrician in the world should be like, "Oh, you shouldn't have come." Right? That's what we're here for. The other thing I want to say real quick is you mentioned brown skin, and I think that is so important because all or almost all of the medical books have lighter skin in all of the dermatology photos, right? So there's actually a really cool movement going on. There's a really good, oh, I can't remember the name of it right now, shucks, but there's like an Instagram with all sorts of different rashes on different skin tones so that doctors and other people alike can learn what hand, foot, mouth looks like not on Caucasian skin so that they can learn about the strep rash. They can see how Lyme disease presents on different skin colors and skin tones. And so I think that's really important as well. And, you know, as a pediatrician, I try really hard to find photos of a lot of these common rashes and learn what they look like on all sorts of different skin tones so that I'm not kind of preferentially treating one kid differently just because I don't know what it should look like on their skin. Does that make sense?
Hmm. And I appreciate you doing that, because it's very common to go in and you can feel defeated and like deflated, because I know with that experience with taking my daughter in for like Lyme disease, one doctor who may have been the resident, I don't know, they thought, "Oh, she just fell and bumped her knee. That's why she's limping." And
Mhm.
then as I talked more about what was going on, the doctor, I guess, over that person was like,
Yeah.
"Let's just test her for Lyme disease."
Yeah.
And I was like, "Well, this doctor said she just bumped her leg. Now you're talking something with the word disease." I'm panicking. And then she was just like, "This is why I think that. You said you were outdoors. We're in this part of Pennsylvania. It's pretty common. Let's just check."
Yeah.
And, you know, that was, although I was pretty livid about the first doctor, I know medicine is a practice, but I was like, "Come on, bro. I almost left here and my kid had something going on." But
I hear
just, you know, we're all learning as we go. Like, I'm new at this. I don't know what to say when I go to the doctor. I'm just like, get a little concerned, and I want my baby to be good. So that is very helpful. Can you tell us about,
real
oh,
quick,
go ahead.
Brittany, can I pause for a sec?
Yeah.
Just so that you know, I don't want you to feel guilty because not all people with Lyme disease have the bullseye rash.
Oh,
Could it have been there and you didn't see it because of a darker skin tone? Maybe. But it is not always there. Like that is not something that you have to see. Certainly if you have a bullseye rash, it's like, oh, that's easy. I know what that is. But if you don't, you have the other symptoms, I don't want you to feel guilty or any mom guilt about not seeing the rash because it's possible your daughter just didn't have it.
mm,
I just want to let you know. Don't feel
thank
the mom
you.
guilt for that.
Thank you.
You
I
bet.
appreciate that. Yeah, I'm always, I think now, anytime something happens, I think about that, because it's been like years, and they were like, "We caught it early enough. Like, she's probably
Yeah.
going to be fine." And then
Oh,
I'm like, is that Lyme disease creeping up again? Because you just don't know.
well, so with Lyme, right? Like that's treated and that is done with. Could she get it again? Absolutely, if she were to get another tick bite. And in this area of Western Pennsylvania, Lyme is everywhere. And so it is always towards the top of my differential or kind of my list of things that could be going on. So could she get it again? Yes. It would
Mhm.
be a new infection. It wouldn't be the older one coming back
Oh,
if she's
nice.
otherwise doing well
Thank you
now.
for this consult. Now I
You
feel
bet.
much better about that. Can you tell us about like what we should keep in our like medicine cabinet and like the ones that are like don't have what are they like the more natural medicines versus like a Tylenol, or can you just talk us through that?
Um, honey is a good starter, though that's probably going to be in your pantry instead of your medicine cabinet. Honey is a great throat soother. It is a great natural cough suppressant. And it also has some antimicrobial properties to help kill whatever is in that posterior oropharynx or kind of the back of the throat. So that is great for anybody older than a year old. So if you're younger than 12 months, your body can't fully process honey, and there's actually a risk of botulism. So no honey if you're under a year old, but over a year old, honey is great. So that's like my go-to if I am trying to avoid other stuff. Will it help a fever? Probably not, but it might help soothe a sore throat or help with sleep with a cough and things like that. In terms of medicines, Motrin is probably the one that I reach for the most. Of the anti-fever or fever-reducing medications, I tend to favor Motrin over Tylenol because Motrin has an anti-inflammatory property to it. It's an NSAID, non-steroidal anti-inflammatory medication. So, for a kiddo who has a sore throat or an ear infection or a sprained ankle, the ibuprofen or Motrin is going to reduce the actual inflammation, reduce the swelling that's causing the pain. So you're addressing the root cause, if you will, rather than just kind of masking it. Tylenol I use kind of sporadically here and there. I prefer it a little bit less because it's not that difficult to give too much, and it can cause a little bit more serious problems like with the liver. Tylenol's metabolized through the liver, Motrin's more through the kidneys, and I see or have seen in the past more complications from Tylenol overuse than from Motrin. Yeah, so Motrin first, Tylenol second is what I use in my household and what I usually counsel my patients on. Other ones to keep on hand, Zyrtec. So a lot of families love Benadryl, but that is not my favorite antihistamine. So antihistamines are going to be our like allergy medications. There are several classes. There's our first generation, so like the OG originals. Benadryl is the OG antihistamine. But since then, we've come up with slightly better ones. So Benadryl affects our whole body, and including our brains, right? That's why we get really sleepy. Why, like back in the day, hopefully not anymore. I remember parents giving their kids Benadryl before a long flight or a car ride, and I'm like, oh.
Yeah.
So that's Benadryl. Zyrtec and Claritin both fall under our second generation, and so they actually have less of a sedating effect. They're more specific, so they more specifically just affect what needs to be fixed for allergy symptoms. And then you have like a third generation that includes Xyzal, which is a newer one. Zyrtec tends to be my favorite. So for families who have kiddos with allergies or who are worried about some sort of allergic reaction to a food, for example, as they're introducing new foods to their babies and stuff, I always say keep Zyrtec on hand. And then in terms of some topical things, Neosporin's great and easy, but there are some chemicals in it that some kids actually react to and get a worse like rash or reaction from that. So bacitracin is one of my favorites, and I think that's something that you can get over the counter just as like a cut and bump scrape kind of thing. Or if you see a red bump popping up, maybe rub some Baci on it and see if that fixes it. And then the other one that I always have on hand is just over the counter regular strength hydrocortisone cream, just to put on itchy rashes and stuff. That stuff is pretty easy to use, couple times a day for a couple days at a time. If you got poison ivy or an itchy mosquito bite or something like that.
Oh, that's perfect.
So that's my medicine cabinet, minus any prescription meds that my kids need or things like that.
Yeah, and that is simple enough to keep on hand and keep stocked because, as you said, our kids are going to get a lot of colds and, maybe cuts and bruises from being outside. So that is super helpful. I appreciate
Totally.
that. Before I let you go, could you tell us a little bit more about Zest Pediatrics, if you're
Yeah.
accepting new patients, how to connect with you, and all of that?
Absolutely. So Zest Pediatrics is a network of doctors. There's large handful of us at this point, who I think I could say we all kind of got fed up with the classic system of trying to fit in 30 or more patients per day and just feeling like we couldn't provide the care that we wanted to provide in a short visit that we were confined to. So we are all pediatricians who provide what's called direct primary care, or we like to say direct pediatric care, or DPC. And the DPC model goes like this. So we still encourage families to keep their insurance that covers things like broken bones and x-rays and hospital visits if you need your appendix out and things like that, right? Because I can't promise that, like, I can't prevent an appendix from deciding to hate the body, right? But for the regular pediatric care stuff, the well visits and any of the sick visits, we have a monthly membership. So our families have a membership each month, and that model allows us to keep our patient panel low. So the number of patients kind of assigned to each doctor low. So before, in a typical office, a pediatrician might have several thousand patients that they are kind of responsible for. With DPC, we can keep it to a couple hundred or less. Most are like 200 or less. I can do visits. I can do home visits if I want. So, like, I offer newborn home visits and home visits for the first several months of life. I do a lot of lactation and breastfeeding support as well. We can spend 2 hours or more in the office. One of my colleagues spent 4 hours with a family one afternoon, really just like going into the weeds and figuring out what was going on, and ended up sending some further testing and finally getting a genetic diagnosis that explained everything that was going on for this child, which was then helpful for future family planning and things like that. So we kind of don't have the same constraints that other offices do because of the way that our model works. We like to think of ourselves as like a pediatric best friend or sister or brother, somebody who you can text anytime. So part of the model is that you get 24/7 access to your specific pediatrician. So all of my families have my cell phone number and can text or call at any time with any sort of concern. So, like, hey, Samantha has a fever, a headache, this, da, 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 da. What should we do? Should we, keep doing things at home, or, at what point should we bring her in? And then we can talk about bringing her in, or, doing a strep test or whatever, things like that, taking a look in ears. We do regular business hours, but we also offer evening hours, weekend hours, because we know that parenting is hard enough. And part of my goal as a pediatrician with Zest is to reduce the mental load on parents, right? The last thing that you should be doing is stressing about how you are going to get medical care for your child. So I don't want you up at 11:30 p.m. thinking about calling triage the next morning to then talk to a nurse, to then leave a message, and then possibly hear back from a doctor, but still likely a nurse relaying what the doctor said 5 hours later, and then missing that call because you're at work, right? Like, no, just shoot me a text. And as long as it's not urgent, I'll respond to you within a couple of hours when I wake up, like, hey, no, it's fine. Or like, hey, yeah, bring her by this morning whenever you're free, or this afternoon or evening whenever you're free. So that's kind of the goal. We do still use insurance for, if the kiddo needs labs or needs imaging, like x-rays or something like that, that still gets paid for by insurance. And vaccines also get billed through insurance. But the rest of like the basic care and love and support that we provide is part of the Zest membership. And most families find that the membership basically pays for itself in terms of saving you copays. We don't have any copays. It's just one flat membership per month. And avoiding urgent care visits and avoiding ER visits, because we can care for kids at home and prevent the need to go to the ER because we're right there and easily accessible.
Oh, that's wonderful.
Yeah. And
That's
yes, I'm accepting new patients.
awesome. Well, for our listeners, like, definitely check that out. And I love just that approach to, and I was just said of reducing the mental load, because I'm all about that. And you do
Right?
end up being up late at night thinking about your kid, and you're like listening out for their breathing. Now you're
Oh yeah.
tired, and then you're like, I hope I don't get sick because I've been home with you all week. And if I get sick, then I gotta be home next week. And like, what are we gonna do? So it's just nice to have someone just with you in your corner, like being a part of your village. You said that like in your bio, you just want to be a part of our village. And I think that's important and beautiful. Any other send offs you want to give to our listeners before we end?
I think just we're all doing our best. And I just, for all the moms listening, I just want to tell you, you're doing great. I don't know you, but regardless, you're doing great. You are doing the best you can in whatever situation you are in. And I think just sending out that love and support to all of the mamas or other caregivers listening is important. And we're here for you. And if there's anything that I can do to support you, you let me know. So feel free to reach out. I don't know, Brittany, if you're able to include my like website or email or anything like that, but happy to help. Here for you guys.
Absolutely. I will drop all that information in the show notes. To our
Excellent.
listeners, thank you. And Dr. Hellstern, keep doing great work. And I appreciate your time today.
Thanks. It was great talking with you, Brittany.
You too. Thanks for listening to this episode. I hope you learned at least one thing you can implement into your daily routine. To connect with me, follow at Back to You in 5 on Instagram. If you're feeling generous, share this episode with a mom you know and subscribe to the show. I appreciate your support. Remember, motherhood is a journey, not a destination. Grow through it and enjoy the view.